Bismillahirrahmanirrahim. Assalamu alaikum. Welcome guys in today's session. Today's session is on teaching template, how to teach your junior and the template on the ring pessary insertion. ये मैंने बहुत guys की demand पे आज record किया है. So how you teach your juniors? एक format है teaching का कि अपने juniors को कैसे teach करना है. You must know this. So let's how to teach your junior. First, you introduce yourself. अगर कोई भी आपको बोलता है कि she is your junior, suppose you are R4 and your junior is R2. She is about to go appear in the IMM exam and she want to know more about the pessary insertion. So your supervisor told you that you teach your junior on the pessary insertion. So you first introduce yourself. कि मैं अपनी introduction कराऊं और report develop करूं. So say just like this. Hello, I am the registrar R4 and you are. तो अपना नाम बता देगी. If you know her before that, okay. So say just like that. Saira, I'm the registrar and I'm here to teach you about the pessary insertion. Or you say that, hello, I'm the registrar and you are. Nice to meet you. So after the introduction, you have break the ice. Ice कैसे break करनी है? अब आपको पता है कि उसका exam है. So say her, understand that you have your exam around the corner. How's your preparation so far? I wish you the best of luck. Or she's newly joining in your ward from rotation. Just say that I heard that you joined us recently. How's going so far? In this way, अगर कोई उसके वार्ड में बुलिंग भी हो रही है या कोई भी उसको इशू है वो आपको बता देगी. ठीक है? So in this way you have to rule out the bullying too and break the ice. After that you have to confirm the aim of the meeting. I understand that you are one who wanted to know the pessary insertion. He said yes. Okay, so ask why he wanted to know. Can you tell me why you are interested in the pessary insertion? Check what she already knows about the pessary. So say her, Sarah, have you ever seen or done this before? अगर उसने देखा होगा तो बता देगी और अगर उसने किया होगा तो भी बता देगी. अगर रॉन्ग करती है तो भी बता देगी. Right? Okay. After that, ask what they are expecting from this session. Then you set the agenda कि आपको करना क्या है. जब भी कोई मीटिंग होती है, कुछ भी होता है, तो हम लोग अपना एजेंडा बनाते हैं. इस मीटिंग में हम ये चीजें करेंगे. So in the agenda, you have to provide a teaching plan. So say just like this. In the next few minutes, we are going to cover. I'll show you the different types of the pessaries, the indications, the contraindications. I'll show you the step by step how to insert the pessary, and after each step, I'll let you repeat it after every step. Then you will discuss the follow-up. At the end, we will provide you with some useful website links and videos and ask how it sounds to us is a today's session. Right? So आपने पूरा उसको एजेंडा देना है कि आज हम क्या करेंगे. आज के सेशन में मैं आपको डिफरेंट टाइप्स पेसरी दिखाऊंगी, उसके इंडिकेशंस बताऊंगी, इंडिकेशंस बताऊंगी जो बहुत ही इंपॉर्टेंट है बिफोर इंसर्शन द पेसरी. उसके बाद मैं आपको प्रोसीजर दिखाऊंगी, स्टेप बाय स्टेप करके दिखाऊंगी और फिर आपको चांस दूंगी कि आप मुझे करके दिखाओ. उसके बाद हम फॉलोअप में आपको बताऊंगी और सम यूजफुल लिंक्स, वेबसाइट, वीडियोस दूंगी ताकि आप घर पे भी जाके देख सके ये कैसा है. So she said, okay, it sounds good. So this is your agenda. You must told the agenda. In the end, अगर लास्ट में आप लोग उसको वीडियो वेबसाइट देना भूल भी गए हो तो आपने स्टार्ट में इसको एजेंडा में बता दिया है तो एग्जामिनर विल नो दैट शी नोज अबाउट दैट कि इसको वेबसाइट लिंक्स और वीडियोस भी देंगे. Clear? So this is the journal template. After making the agenda, start the teaching. अब टीचिंग आपने जैसे करनी है उसको जैसे आपने बताया था कि मैं आपको टाइप्स बताऊंगी, इंडिकेशंस बताऊंगी, कंट्रो इंडिकेशन बताऊंगी. सो ड्यूरिंग टीचिंग टॉक यू हैव टू रिपीट इट, टॉक, रिपीट, आस्क फॉर फीडबैक. व्हाट डू यू थिंक what went well, what could have gone better. जब आपने सब कुछ कर लिया तो एंड में उसे पूछ ले कि क्या चीज अच्छी थी, क्या बेटर कर सकते थे, आप मुझे फीडबैक दो ताकि हम फ्यूचर में भी ऐसे कर सके और अपने आप को इम्प्रूव कर सके, राइट? ओके, then give another appointment to meet you for further practice. Reference sources, must give her the reference sources. Tell him her where she can find further information. Website, video links, guidelines. ये इसको must देनी है. Put in mind the patient's safety, the communication with patient. If she does it correct, say excellent. अगर वो आपको करेक्ट करके दिखा रही है, उसको बोला excellent, good, you are the good learner, good job. अगर वो wrong भी कर रही है तो उसको ये नहीं बोलना कि आप गलत कर रहे हो. Just say this is a good start, but if you could do in this way, like this, it would be more better way. उसको काउंट नहीं करना. So ये नहीं बोलना कि आप गलत कर रहे हो. Just say this is a good start, but if you do in this way, it would be more better. ठीक है, तो वो डिप्रेस नहीं होगी. यूज द फॉलोइंग टीचिंग प्लान फॉर ड्रिल्स. अगर आपको ड्रिल्स की टीचिंग करनी है, सो ड्रिल्स में आपने ये सब कुछ बताना है. इंडिकेशंस, कंट्राइंडिकेशंस, alternate options, the procedure, the preparation of the patient, which include consent, stopping, equipments, medications, positions. After the technique, with demonstration ideally on the mannequins, remember the prerequisites pre-exam, complications and the post-procedure care. कि कोई भी ड्रिल करनी है, ये सारे स्टेप्स आपने सब बताने टीचिंग में टू योर जूनियर. सो लेट्स सी गाइस, आपका क्या क्या असिस्ट किया जाएगा इन द एग्जाम. द क्लिनिकल स्किल्स टू बी assessed by an examiner, that is a communication with your colleague, information gathering, communication with patient, patient safety, and the applied clinical knowledge. In the teaching, you see that how you introduce yourself to your junior. Trainees or sometimes midwife, nurse, आप किसी को भी सिखा रहे हो, तो आपने उसको कैसे introduce करना है. Explain the purpose and agenda of the session. Checking background knowledge, setting friendly environment, using appropriate language. अब यहाँ पे आप मेडिकल पर्सन को पढ़ा रहे हो तो जॉर्गन अलाउड है. अगर आप पेशेंट से बात कर रहे हो तो मेडिकल जॉर्गन इज नॉट अलाउड. Invite questions, appraise, check understanding at regular intervals. Encourage hands-on use of drawings, non-blaming, humiliating atmosphere in the feedback session, asking for the colleagues' feedback, also eye contact and the body language. These point are in the communication with your colleague. अब आप उसको पढ़ा रहे हो और आपकी आंखें नीचे होंगी तो it's not your good communication. Your body language, your eye contact, your friendly environment and your way of talking, the soft language, your introduction, asking her name, explain the purpose, the agenda, check her background knowledge, वो पहले से उसको क्या बताए और वो क्यों करना चाह रही है, उसकी एक्सपेक्टेशंस क्या है. अगर वो सही कर रही है तो उसको अप्रेज करें, अगर वो रॉन्ग कर रही है तो उसको टांटिंग नहीं करें, उसको बता दें कि दिस इज द गुड वे, गुड स्टार्ट, बट इफ यू डू इन दिस वे, give her the hands on and in between ask, check her understanding. Am I clear to you? Am I clear to you? Do you have any questions so far? So in this way you have to communicate with your colleagues and you will get the full marks if you are using all these parameters. Information gathering आपकी क्या होगी in the teaching session? Checking his her background knowledge. Usually this is also marked as a communication with your colleague. This is also coming in the information gathering. Communication with your patient or dummy or mannequins, or so in the drills there is a mannequins. So introduce self by name and role to the patient or mannequins. And obtaining consent to carry out the procedure. आपने अपना नाम बता दिया, आपने कोई भी प्रोसीजर करना है, आप फॉर्सेप लगा रहे हो, वैक्यूम लगा रहे हो, पैसे इंसर्ट कर रहे हो, उसको बता दें, उसके नाम से कॉल करें कि ये हम पैसरी रख रहे हैं, उसके लिए आपकी कंसेंट चाहिए, या शो हर कि दिस इज अ पैसरी, और उसको फुल प्रोसीजर के दौरान इंफॉर्मेशन देती जाए. So this is also the part of the patient safety. The communication with patient, this is also the part of the patient safety. Patient safety में क्या क्या आएंगी? Is obtaining the consent, when to intervene during the session. Sometimes actors are जो आपका junior है वो deliberately mistake करेगा. So when you intervene, relevant safety points, when you involve the senior, like in the shoulder dystocia, if there is failure of the first line maneuver, if there is failure of the second line maneuver, and for the third line maneuver, you will call your seniors. So most importantly, not lying about things you don't know. आपको अगर नहीं आ रहा है and झूठ नहीं बोलना, उसको गलत information नहीं देनी. Just say, okay, I'll go and search the literature and we'll let you next in the next session. Or say just like that, I'll ask with my from my supervisor and then let you inform. Right? So उसको wrong information नहीं देनी. अगर कोई question कर रही है और आपको नहीं आ रहा है, I'm going, I'm go and search the literature and will answer you later on, right? So applied knowledge discussion should be evidence based. अपनी तरह से नहीं बोलना है कि मैं ऐसे करती हूँ, मेरा सीनियर ऐसे करता है. No, it should be evidence based and according to the relevant guidelines. SOGP guidelines, if we are doing the Pakistani exams and if we are doing the MRCOGs, then green top guidelines or nice guidelines or top articles, and this applied knowledge applied to the situation. Situation क्या है, case क्या है, उसको उसी हिसाब से apply करना है. So these are the domains, the soft skills which are assessed by your examiner कि आप कैसे कर रहे हो. Okay, so let's see the teaching station. This is the scenario. You are about to see the Saira who is taking her IMM exam. She wants you to teach her about the ring pessary insertion. You have 10 minutes during which you are expected to conduct a teaching session on pessary insertion. Answer the Dr. Saira's concerns. You will be assessed for communication with colleague, communication with patient, information gathering, patient safety, and applied clinical knowledge. So how you teach the Saira, I'll show you how you teach the Saira. Hello, I'm the registrar and you are. Nice to meet you, Saira. I came to know that you have your exam around the corner. How's your preparation so far? I wish you the best of luck. I understand you want to know about the pessary, is that right? Can you tell me why you are interested in the pessary insertions? Saira, have you ever seen or insert pessary before? What are you expecting to get out of these sessions? Okay, Saira. So I'll just give you a quick overview regarding what we will be covering today. I'll show you the different types of the pessary, the indications, the contraindications, which are important safety points that need to be fulfilled before inserting the pessary. I'll show you step by step how to insert the pessary, and after each step, I'll let you repeat it after me. Then we will discuss the follow-up. At the end, I'll provide you with some useful website links and videos. How it sounds to you, Saira? It sounds good. Okay, so Saira, first I'll tell you the pessary. The pessary can either be made out of the latex, silicone, or vinyl. It is autoclavable and comes in different sizes and shapes. It stretches the vagina and treat the pelvic organ prolapse. If you see here, these are the different types of the pessary. If you see here, these are the different types of the pessaries. There are two types of the pessaries. The support pessaries, these are the ring, shelf, and hodge pessaries. The support pessaries, the ring pessary, the shelf pessary, and the hodge pessaries. These pessaries are used for mild degree prolapse in a sexually active woman. The second type of the pessary is the space-filling pessaries. These are the gel horn, tube, donut, These are pessaries which are used for women who are not sexually active and having a third degree prolapse. Can you quickly tell me the different types of the pessary? So coming to the indications of the pessary insertions, women who are not fit for the surgery, who refuses the surgery, who have pelvic organ prolapse with the pregnancy or want to have a children. Can you repeat it some indications for me? Coming to the contraindications, which are important safety points you need to keep in your mind before inserting a pessary. They are active genital infections, vaginal mesh erosion or mesh inserted, medical or social reason which causes the woman not to be compliant with follow-up, because the follow-up is very important after inserting the pessary. The last one is the latex allergy. If so, then you can offer her a silicone or a vinyl pessary. Saira, can you repeat the contraindications for me? Good, Saira, you are a good learner. Coming to the procedures, so first let's go on to our patient. The first thing you would be do is to take a history to ensure she does not have a contraindications. Take an informed consent from her. Ask her to wait. When she comes back, put her in the dorsal or lithotomy position. Then examine her. Why we examine her? You want to determine which size is suitable for her, that is comfortably and stay inside. For that, I'll show you how you confirm the suitable size of the pessary. I'll insert my two finger of dominant hand like this and measure the distance from the posterior vaginal fornix up to the symphysis pubis. By examination, you also confirm the pelvic organ prolapse and exclude any ulceration or atrophy. Am I clear to you, Saira? Okay, good, Saira. So coming to insertion, how we insert this, see this is the ring pessary. First, I'll wear my gloves, apply lubricant to the leading edge like this. With my non-dominant hand, I separate the labia. With my dominant hand, I'll insert the pessary at a right angle because it can be uncomfortable for the patient. I'll split it like this, push it inside, and let sit rest around the cervix with upper edge of it pressing against the anterior vaginal wall and lower end pressing against the posterior vaginal wall. After that, ask the patients to walk around, go to bathroom to white. Ask any discomfort and was she able to urinate? Examine her to see the pessary is in place, meaning the size is appropriate. If the size is appropriate, then okay. If the size is not appropriate or inappropriate, then or she does not white or could not white, we will change it to a different size. Am I clear to you, Sarah? Could you show it me how we insert the pessary? Good, good, Sarah. You are good learner. Coming to the follow-up, our first follow-up will after 2 weeks, you ask her if she has any bleeding, pain, or discomfort. Examine her to remove it. Clean with soap and water. Examine vagina to see if any pressure points or ulceration. If all is good, then clean and reinsert. Teach her how to clean and reinsert. Tell her to do it weekly. Her next visit will be at 2 to 3 months or 2 months, then 6 to 12 months. If she is unable to change the pessary alone weekly, she will have a frequent visit every 2 to 3 months for cleaning and reinsertion of the pessary. Am I clear to you, Sarah? Could you repeat the follow-up? Okay, Sarah. So give me the feedback. What do you think? How was the session? Do you have any questions? Thank you, Sarah, for your time. These are some links of videos on the pessary